Hey there, and welcome. Today, we're diving into some really powerful evidence about diet and supplements and how they can potentially support standard treatments for multiple myeloma.
A myeloma diagnosis just floods your mind with questions. And probably one of the biggest is, okay, what else can I do? It's that completely natural desire to be an active player in your own health, to do everything you can to help your body in this fight.
So that's the big question we're tackling today. We're going to cut through the noise and look straight at the research. We're going to spotlight three, I think, really fascinating areas of evidence. The delicate balancing act of iron, a very surprising ally in statins, and the absolutely crucial role that your gut health plays.
First up, let's talk about something so basic to our bodies, iron. But as it turns out, myeloma has this really complex, almost cunning relationship with it. And getting that balance just right is, well, it's a huge deal. It's kind of wild when you think about it. Myeloma essentially weaponizes your body's own systems. It causes anemia by robbing your healthy red blood cells of iron. And at the same time, it uses this iron storage protein, ferritin, as fuel to help it grow. So as the research shows, high ferritin levels actually become a risk factor for progression.
So how important is getting this balance right? Well, one study found that patients who managed to significantly improve their hemoglobin levels during therapy saw a massive 77% reduction in their risk of progression. I mean, that's a crystal clear signal that fixing your iron metabolism is directly tied to better outcomes.
Okay, so what's the game plan? The evidence points to a supplement called lactoferrin. It's a protein that basically helps the body handle iron the right way. It helps you absorb it when you need it for healthy hemoglobin, but it also helps prevent that buildup of high ferritin that the cancer feeds on. The strategy is really twofold. You nourish your body, and you starve the cancer.
All right, let's shift gears to our second spotlight. And this one might really surprise you. We're going to look at a type of drug that many of us know for completely different reasons, statins. The research here is pretty amazing.
So picture this. Researchers are digging through these huge patient record databases, in this case, from over 4,300 patients in Sweden, and they start noticing this really strong pattern. Patients who were taking statins after their diagnosis were just doing better. This wasn't a planned experiment, but the observation was so powerful, they had to take a closer look. And here's what they found. I mean, just look at this chart. It's pretty clear, right? Using a medium-intensity statin was linked to a 27% reduced risk of progression. And for patients who use statins for a longer time, that risk reduction jumped to 35%. That is a really compelling trend. Now, just to be super clear on what we're talking about here, while those big studies are looking at prescription statins, the source material also points out that red yeast rice, which is a supplement you can buy over the counter, is actually the natural source of lovastatin, which is one of the statin drugs. Okay, for our final deep dive, we're going microscopic. We're heading inside to the gut. It's this whole universe living inside of us, and the new research is showing that the health of these trillions of bacteria could be a massive factor in how well myeloma treatments actually work. Think of your gut as a support ecosystem. When that ecosystem is healthy and diverse, it seems to create an environment where your body just responds better to therapy. And this connection is especially strong in studies looking at patients getting advanced treatments like a stem cell therapy.
How strong a connection are we talking about? Well, this number is just stunning. In one study looking at stem cell therapy, the failure rate was 3 times lower for patients who had a good amount of a specific beneficial bacteria called Blaudia. 3 times! That's a huge difference.
And it doesn't stop there. Get this. In that same study, another critical bacteria, Akkermansia, was completely missing from every single patient whose therapy didn't work. Bigger picture, studies are showing a diverse microbiome is linked to a 30 to 50% improvement in overall survival. And the really cool part is, you can do something about this. Research shows that functional foods like walnuts and oats can help support these exact bacteria. So those 3 areas are huge, but believe it or not, we're just scratching the surface. The research on complementary approaches is exploding right now. So let's do a quick lightning round on a few more areas with some really promising data. First, vitamin D3. It's super common to be deficient at diagnosis. One study found that white patients who had sufficient levels of vitamin D3 saw a 45% overall risk reduction for progression. That's a massive signal about why it's so important to correct any deficiencies. How about something as simple as low-dose aspirin? Well, an analysis of over 400 patient records found that taking it regularly after diagnosis was linked to an almost 40% reduction in mortality specifically from the disease itself.
And finally, check this out, an herbal extract called danshen. When researchers in Taiwan looked at their national patient records, they found risk reductions of over 60% for myeloma patients who added danshen to their regular oncology treatment.
Okay, wow. We have just covered a lot of really compelling data. So, now what? Well, the whole point of this explainer is to take this information and turn it into real empowerment for that next conversation you have with your doctor.
And this right here, this is the most important slide of all. So let me be absolutely 100% clear, this information is for educational purposes. It is not medical advice, and it is never, ever a substitute for a conversation with your healthcare team.
So here is the real takeaway. Research is a powerful tool. The goal here isn't for you to go out and self-prescribe, but to help you ask smarter questions. It's all about building a stronger partnership with your oncologist and using this evidence to explore every possible way you can support your health together.
Which brings us right to the end. As you think about everything we've talked about, from iron to statins to your gut health, I want to leave you with this question. What's the first thing this evidence makes you want to ask your doctor at your very next appointment?